Hi, my name is Marion Payne-Holman. Today for my mini lesson, I'm going to be talking about autism spectrum disorder, or ASD, and I will be using a presentation. All right. So again, as I was saying, I'm going to be talking about autism spectrum disorder, or ASD. So I'm just going to start with what it is. Autism spectrum disorder is a neurological brain disorder characterized by difficulties in social interaction, verbal and nonverbal communication, and repetitive behaviors. It can cause significant social, communication, and behavioral challenges. And we'll talk more about that and how that relates to issues in education and general education class and classroom setting, and the typical characteristics that we see. I want to note, though, that the term autism does not apply if the child's educational performance is adversely affected primarily because the child has an emotional disturbance. So if a child is emotionally disabled in a way, it does not mean that they have autism. And so ASD includes autistic disorder, pervasive developmental disorder, not otherwise specified, and Asperger's syndrome. These now all fall under the umbrella of autism spectrum disorder. They used to be diagnosed as their own disorders. But as we'll see here, autism is not linear. I got this graphic from Dr. Walker here at BYU, and basically it shows how it is a spectrum. I just want to highlight how each person with autism will have a set of traits all in different areas of the spectrum. It's very variable between individuals, and so it's important to know that it doesn't mean that one person is more autistic than another or less autistic. It's very difficult to quantify, and that's important for how we change and accommodate students in our classrooms. However, there are ways that we can at least understand what support they need. This is also a graphic from Dr. Walker. This is from the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Basically, it just tells us kind of levels of autism and how much support they may need and how we can recognize that. People may fall in between these levels. Again, it's not clear cut, but at least this gives us kind of an idea of how much support they may need. So level 1, high functioning, needs support. Patients' social and communication skills and repetitive behaviors are only noticeable without support. Level 2, their social and communication skills and repetitive behaviors are still obvious to the casual observer, even with support in place. Level 3 needs the most support, and basically their challenges with their social communication skills and repetitive behaviors severely impair their daily life. So this lets us know, if we can kind of see where someone is at, we can understand how much support they need from us. So here are just some common characteristics. There may be no pointing at objects to show interest. They may not look at objects when another person points at them. They may have trouble relating to others or not have an interest in other people at all. They may avoid eye contact, which is something that people usually think of the first thing when they think of ASD. They may have trouble understanding feelings or talking about their own feelings. They may prefer not to be held or cuddled or even touched. This could be due to some sensory issues. They may be unaware when other people talk to them, but aware of other sounds. And then on the flip side of having no interest in other people, they may be interested in people but unsure of how to interact. And that can cause some problems socially and can also create isolation and hinder their educational progress. They may not be able to express their needs with typical words or emotions. They may not be able to express what they need to us, and we need to know what we need to give them. They may not be able to play pretend games. This is more common probably in children. Like they may have troubles with dramatic play, and they may have trouble adapting to change in daily routine, and so it's important to have structure in the classroom, and I'll go more into that later. So some causes, it's important to know that we don't know all of the causes of ASD, but it's important to see that, there are some factors. So there is appeared to be a genetic link. It is more often present in people with other chromosomal conditions, usually it can accompany Fragile X. Sometimes prescription drugs taken during prenatal development may affect if the fetus will eventually develop ASD. Older parents, pollution and toxins have also been linked to ASD, and then lack of folic acid taken during pregnancy has also been linked. But it's important to note that, contrary to what some people think, it is not caused by vaccines. As you can see in the photo, there's some immunizations. There's a smiley face to show that we need immunizations. Diagnosis. So it can be detected at 18 months or younger, and it's important to get it detected early on so you can start early intervention. But there are certain signs that professionals look at, mostly behavior and development. We can't just do a blood test. or even look at someone and assume, oh, they have ASD. So it takes some observation and professional skills. And no race or socioeconomic group is exempt from developing ASD or having ASD. And it appears to be 4 times more common in boys than girls. This could be, though, to the fact that perhaps girls may show different signs and maybe are misdiagnosed or not diagnosed at all. So I'm now going to be talking about ASD in general education and the challenges that can occur for individuals with ASD in the general education classroom, and kind of how we can focus on some good ideas and ways to help. So some challenges, as explained before, are some social issues. They may feel isolated and may not be able to talk with other students or even collaborate with them or even answer questions. It may not be able to ask for help, and this can cause problems because, that is a crucial area to learning. Learning is a social thing. They may have a limited vocabulary. They may not be able to express themselves the way they need to. Again, we may not know what they need, and it can be frustrating for them and for teachers. There may be some sensory overload. Classrooms can get busy, and it can get to be too much, and they may lose focus or exhibit some issues with behavior because of that. And they may have difficulty with transitions and change due to the busyness of classrooms. Routine is very important. It's very secure and safe thing for them. And so when you do have to change and transition to something else, it's important to make sure that it's structured. And we'll go into that in a second. But before that, I want to continue with a video. This is of Temple Grandin. It's very short. She's a professor and has ASD, and she's a spokesperson for ASD, the community. She's going to talk about, again, kind of reiterate what it is. And she even has some views about education and individuals with ASD.
Dr. Grandin, let's start at the very beginning. From your perspective, what is autism?
Autism is a neurological disorder the child's born with, and it can vary from very severe, where the child remains nonverbal with many other problems, maybe epilepsy and seizures, to geniuses out in Silicon Valley. You get a little bit of the autistic trait, you might get a Mozart or an Einstein. You get more of the trait, you can get very severe problems. One of the main problems in autism is, lack of social understanding. That tends to be repetitive, fixated interests. Often these kids get intense special interests. We need to use those special interests to motivate schoolwork. The kid likes airplanes, let's teach reading with airplanes, math with airplanes.
So I want to kind of talk about how Temple mentioned how those with ASD can get fixated on things and how we can use that as teachers and just educators to help them learn. I had an experience with this I just want to share. Over the summer, I worked with preschool children, and there was one preschool child who was being tested for ASD, and he was very fixated on sea animals. And we often couldn't get him to accomplish assignments or even connect with the other children because he was so absorbed in his own interests and kind of wasn't doing so great socially and kind of was losing focus. So we decided to model and focus some assignments on sea animals. And that really got him excited and really got him interested in what we were teaching. And it also was able to kind of bridge a gap between him and the other children. So I really agree with what Temple has to say, and I kind of want to go that a little bit more right now. Let me just move forward. So I'm just going to talk about some classroom strategies. Again, there are probably many more. This is based off our readings and also the case studies that we've been looking at. So behavior plans can be done and created with IEPs especially, and having goals can help us as educators understand what we need to do with providing for the child. A transition plan also helps with issues with transitions and changes. If we are just able to make sure that we have a safe and secure and very detailed transition plan, moving from activity to activity and kind of almost give them warning, I think makes them feel a little bit more secure and less, nervous about it. Maybe help them focus more. A paraeducator in the classroom is so helpful because as an educator, there are plenty of other students in the classroom that you also need to attend to, even though this particular student may need some extra help. And a paraeducator is so helpful for that. In the case study of Sean, who had ASD, one of his services that he was offered was a paraeducator to help him in moments when the teacher couldn't get to him. And I think keep him focused, keep him feeling safe, keep him, on hand, and to help with any sensory overload issues. Assistive communication devices. Again, this is kind of an example seen from Sean's case study and his IEP. He didn't have the vocabulary needed to be able to properly communicate everything he wanted to communicate. So he had a device, I believe, where he typed it in and it spoke for him. And these can be really great for students with autism because it also helps them be more social and really tell you what they need. And even if they can't tell you, you can better understand it. A place to regroup would be great with sensory overload issues, a place to kind of come back to focus, and paraeducator can lead them there. You can. It's just a nice space for them to really understand, to get away from the sensory overload that they might be experiencing. Group work in small groups is a perfect way to kind of help them be more social with other students. Step-by-step instructions and visual and concrete examples are great too because they're very concrete. They're very, detailed. This child knows what we expect of them. There isn't any confusion or vagueness. Again, nothing to really prompt any problems if we just are giving them, okay, this is this, something that they can better understand visually and concretely. Sometimes they may need extended time to complete these tasks. Again, this was in Sean's IEP and his case study. If they lose focus or if they may not feel focused in a certain area, there may be some extended time that is necessary for them to complete their assignment so they can still stay ahead of the game and where they need to be. And lastly, another one, some minimal distractions with assessments, and this could be with assignments as well. And again, this is another thing seen in Sean's case study and IEP. So here are my sources if you want to take a look at those. Again, there are plenty of more resources, things that teachers can do to help students with ASD, but I thought this covered a decently at the basis of it, of how we as general educators can help students with this particular disability in our classrooms.